Now, following recent heavy rains and widespread flooding in Limpopo, health officials in the province have announced that since April last year, a dozen people have died from malaria. There have been more than 800 confirmed cases in the province. Now, the health department says these numbers show the ongoing challenge of controlling the mosquito spread disease and are urging people to watch for symptoms and seek treatment very quickly. In response, the University of Pretoria's Institute for Sustainable Malaria Control says it is ready to support government programs to curb the problem. For more, I'm joined by Shikwambana, the Limpopo Provincial Health Spokesperson, together with the Director of the Institute for Sustainable Malaria Control at the University of Pretoria, as Professor Tiaan. Gentlemen, to both of you, thank you so much for joining us this morning. It becomes extremely worrisome when one looks at a situation like malaria spreading so much, and the anguish it could really cause, the deaths it could even cause in some areas too. How dire is the situation, Neil, if we could start with you, from what government is seeing?
Look, we think that it's malaria is still quite a huge challenge in this part of town because of a number of reasons. As you have indicated in your intro, that so far in this current financial year that will end in by March 31st, we have seen already 12 deaths due to this, and this is too many when you compare sometimes to the previous years, because at some point we saw a drop in the numbers to a point where although we can't say it was too small because one death is one but too many, at some point we saw only 4 in a year. So we think it's still a challenge. And if you look at it, Arabile, the 834 cases that we're talking about, by the end of December, we were at 500 cases, counting from the 1st of April last year. So meaning the over 300 cases have just been reported since the beginning of this year in January. And we think the heavy rainfall, the flooding has played a very, very key role, also considering the fact that it has also disrupted our indoor residual spraying period, because we started sometimes in September last year, and because of these rains, we have lost over 30% of our spraying time. So it is still quite a challenge in this province, Arabile.
Yeah, and one looks at this and just think there's been specific conditions that have bred and created this. I suppose, like you said, is those heavy rains as well. Is this something that can be sorted, though, from your point of view, other than just with of course, the help from the University of Pretoria's Institute for Sustainable Malaria Control? How else do we get assistance in ensuring that people know and people are kept safe from this?
Look, we continuously drive awareness because, number one, we are quite conscious of the fact that we are a malaria endemic area, together with our neighboring province, Mpumalanga, and some of our neighboring countries. And we continuously implement programs that seeks to eliminate this challenge. Like I've already said, we have seen the effectiveness of some of these programs in some of the years that have gone by, and we continue to grapple with that challenge. But the elimination aspect, I think it's more of a technical aspect, which I think Prof will talk to, the issues of resistance of the parasite and issues of vaccine development and all those. I think those are in the purview of the Prof to talk about. But at our level, we continue to be guided by science as well in ensuring that we spray in those vulnerable communities, like your far north in the Vembe area, Mopani, your Palabora, Giani, and all those areas. But also one challenge that we need to acknowledge is the issue of malaria that is acquired in transit. We call it cross-border infections as well, because like I've already indicated, there are challenges of the neighboring countries, but also not only the neighboring countries. In Limpopo as well, there are areas which have been known not to be that much endemic to malaria, but because there's a lot of intra movement of people in the province. You see cases in areas where we never thought that malaria could be seen, because we find people
Sure.
staying in this side of town, working
Yeah.
in that side, and then carrying the mosquitoes with them and unknowingly into those areas and causing problems. So there's
Yeah.
a
Okay.
huge and a complex a complexity of issues.
Yeah, it just sounds complex, Prof, if I come to you. And this means that you need to, as you said, remain ready for it and the complexity that then
Yeah.
comes with it as it stands. How ready can you be considering the variances that have just been laid out?
Yeah. Well, as you know, malaria in general is a very complex disease. We're dealing with a parasite, we're dealing with a vector, cross-border movement, climate change. So in a case like this, where we saw severe flooding, it increased the risk significantly. And therefore, we need to take precaution, we need to be vigilant, and we need to inform people. Health promotion, education is very important. Now, from the University of Pretoria Institute for Sustainable Malaria Control side, we're working with various partners, government and provincial control programs towards malaria elimination. Now, this is a significant setback. Now, areas where we can support is obviously by generating evidence to guide vector control strategies in changing environmental conditions. We can provide technical advice, and malaria surveillance and risk mapping is very important, as you've just heard from Neil, because now we start seeing malaria in areas where it's never been before. But also critical to all of this is to providing evidence, education, and training in these malaria endemic areas, including at schools. There needs to be awareness and people needs to take precaution, because malaria is a preventable disease and it is a curable disease. In addition to that, we do, and we've been doing for the last couple of years, building leadership and management capacity within the malaria control programs within the elimination 8 countries. And this is a project funded by the Gates Foundation, and we present leadership courses in English and in Portuguese. As you know, our neighboring countries, Mozambique and Angola, is Portuguese speaking, and it's important that we collaborate, because we need to form a network and partnerships to be able to successful. And last point, supporting the development of health promotion and awareness initiatives. And that's at all levels, for the communities, but also for people and tourists visiting these areas.
Yeah, and I was going to ask you, I mean, what you're seeing in terms of social impact that the outbreak has had on some of the communities that you've had to get involved with as well, and what it is you're pretty much seeing, and as a base case, perhaps, if you could share, Professor.
Yes, I mean, it's devastating. We're talking people losing their houses, everything. So there needs to be measures in place to support these people. And I think what is important is that should they experience any symptoms, to seek help and not wait. Therefore, they should contact their health clinic, healthcare providers, doctors, and make sure that they get treatment well in advance. In addition to this, we support government nationally and provincially to build capacity and to make sure that we get on top of this very bad situation. Things like standing water, cleaning of the area, we need to address, because that is creating obviously breeding spots for the mosquitoes.
Yeah. Neil, let me come back to you. Let's talk about the immediate steps that government and the Department of Health would need to be taking basically here in Limpopo to intensify its malaria control, in addition to what you'd be getting out of the University of Pretoria, especially now that you speak about your spraying being disrupted as much.
Yes, just to indicate that immediately when the rains receded 2-3 weeks back, our indoor residual spraying teams were immediately deployed to go back to the ground to do the spraying in order to recover the lost time as one of the measures. But we're also looking at our technical people looking at dealing with the sources of breeding, destroying the malaria-carrying mosquitoes from those areas where they likely breeding. Our healthcare promotions is in full swing now, ensuring that we bring the necessary education to the people about what needs to be done in terms of preventing malaria, but also, most importantly, for people to seek health early, because like Prof is saying, it's quite devastating that people are losing lives while malaria is fully treatable at the primary healthcare facility. The challenge could be that people seek health when it's already late. Seek help, I mean, when it's already late. So the key message that we're carrying across is that people should not ignore symptoms whenever they feel like they're not feeling well, they've got flu-like symptoms, they've got fever, diarrhea, and so on. They must immediately, even if they feel like they've got flu, let them go to the nearest healthcare center and be treated because they can't take things for granted. Like we've already indicated, it's no longer the question of saying if you are in Vembe or in Mopane or in the Kruger National Park, even when you are in Bela Bela, even when you are in Mokopong or Lepalale, if you feel like that, go to the nearest healthcare facility because you don't know what might have happened. So that even if you got infected, you can get help quite early and quite quickly in order to avert devastations like death.
Yeah, Professor De Jager, this means that your staffing requirements ultimately change as well. How ready from that point of view are you overall for this? And if the anticipation, of course, is that we'd see an increase from the 838 cases and 12 deaths?
Yes, I mean, this is not a challenge for only one person or one entity. And therefore, the more people that can join in supporting government in their efforts would make it easier. But I think a good starting point is, as we've heard, the ABCD of malaria prevention. And that's for everybody, the community and visitors to the site. It's about awareness. Be aware of the risk and the symptoms. The B is biting behavior and the bite presentation to try and avoid that. Chemoprophylaxis, that is to take anti-malarial medication. And then D is diagnosis, early diagnosis and rapid treatment. But in addition to this, I think we also need to look long-term. And therefore, from the University of Pretoria side, we are working with partners like the South African National Space Agency to build early warning systems so that we can use data and make informed decisions and be prepared in times like this. Another thing is the cross-border movement of people causing a significant challenge. And therefore, the healthcare providers, the doctors, if you in whatever province, you should ask about travel history. You should consider malaria as a potential risk for your patients because many of these cases we see pop up in other non-endemic areas, and it is because of travel history or cross-border movement of people. So from the University of Pretoria Institute for Sustainable Malaria Control, we are a transdisciplinary institute with experts in vector control, in parasites, and human health. And therefore, at all levels, we're ready to support where we can.
Professor Tiaan De Jager, thank you so much for the time. Really appreciate it. From the University of Pretoria's Institute for Sustainable Malaria Control, as well as Neil Shikwambana, the Limpopo Provincial Health spokesperson, joining us as we talk about just the surge in malaria cases, primarily in the northern part of the country. But please, 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 everywhere you are, just be wary. Please be careful.